Chantel and I are here this morning at Core Physical Therapy to show you a few things for shoulder and scapular stability. There's usually a mix of folks between really stiff shoulders and shoulders that move too much. And hypermobile shoulders mean that the humeral head kind of rattles around in the socket, or the scapula isn't stable enough, and that can lead to shoulder pain. So we're going to show you a few things for shoulder mobility and stability.
All right, so the first one I'm going to have you do is put a little bit of tension through the red band here. And it's a pretty stiff one. So what I want you to do is think about kind of engaging these back muscles here. And what I want you to do is come up and over. So you're keeping a little bit of tension through that band as you're coming upright.
And how far should I go?
As far as you feel safe, it's going to be a little bit different for everybody. But as long as you can control that.
And my wrists.
Yep, that looks good.
Okay, should we show from the front?
Yeah.
Okay. So what should I watch out for?
So you want to watch out that you're not letting yourself flare outward here. You're keeping good control of your rib cage. So you're not getting too much extension through your thoracic spine or your mid-back.
Good. Cool. Well, that actually feels good.
Yeah, I like that one. All right, so the next one I want you to do is wrap it behind you, and you're going to push straight forward. Yep. So from there, it's almost like you're trying to stretch the band away from you. Yeah. So you're kind of rounding through here.
But not like that.
Exactly. Yep. So you're keeping strong through your back and trying to isolate. It's just the shoulder blades moving.
Okay. So like this. Oop, and my wrists.
Wrists straight. Yep. You want to keep that neutral wrist position. So you're just doing kind of a forward punch there.
Yeah, it's not a lot of motion.
No, it's pretty subtle.
Cool.
Yeah, that looks good. And then the other one I want to try is starting with the band kind of at your mid-back or your lats. And then you want to come all the way under with your elbows. So it'll be totally under your arms and then here. And then I want you to try coming up kind of in that scapular plane. Yeah, and so for this one, you're going to have to really engage here, kind of pulling downward to keep that stability component. Good. How's that feel?
It feels really hard.
It is tough.
But my arms are sore from the other day. So how high do I go?
About to shoulder height, maybe
Okay.
a little higher. Yep. And from the back. So you're kind of looking for these to be engaged through here, not letting them come out too far.
Okay. And this is just one of those little skinny red bands. You can buy them on Amazon.
Yep, exactly. All right.
Cool. Okay. Now it's going to jump up on the bar, and we want to show you what scapular stability means, where your neck and shoulders and torso should be, and this is an interesting problem to solve. So go ahead and jump up. There you go. So first, and can I move your hair?
Yes.
Okay. So I want you to notice this space, okay? Now go ahead and just hang and be sloppy. Okay. So if you don't have your shoulder blades engaged, this is how much space is going to be between your head and shoulders. And this puts a lot of strain on the neck, and it smushes the shoulder in the joint. And so what you want to do is drive your shoulder blades down so that there's lots of space in here. You should feel like your collarbones are wide and your neck is nice and long. So I'm going to put some gentle pressure by your rib cage.
Okay.
So Chantel is pregnant as well as an extraordinary athlete. So she has an incredible amount of muscle control. So show scapular, there you go. So if your shoulders are stiff, or if this is a body pattern, or if your lats are tight, you might find that your rib cage kind of flares out this way. So what you want to do is funnel down there, and you're also lifting by your belly. There you go. So if you can hang out here and there's no shoulder pain, see how long you can stay here. How long do you think you can stay here?
My hands are a little slippery.
Okay. Well, given you don't have slippery hands, it should be a little bit easier. So let's have her flip around so you can see her shoulder blade position, and then we'll wrap it up for today. So go ahead and hop up there. Wipe off your lotion.
Yeah.
There you go. So let's look at your shoulder blades with it being wrong. So just kind of hang out. So when she's just hanging out, her shoulder blades are this way. So now engage your shoulder blades. She's driving her shoulder blades down towards her back. See how she's kind of arched there, so now she's going to go ahead and correct that. There you go. And there's lots of space here. So as long as you don't put lotion on your hands, you should see how long you can hang. And you should be able to do that with shoulder blade engagement for at least a minute. So give that a try, make sure it's pain-free. And from Core Physical Therapy, we're signing off.